Doctor, I have never seen a doctor introducing themselves relating to sports or poetry. Miss Ruxana in the Maldives, I have always heard about giving service. So, like being from the time you are saying you have seen a lot of sick children and people with chronic disease during that time, that is 30 years back, and especially being from a place that's an island place where there's very less resources, right? How many days the child can be with the stuffy, runny nose or cold and cough, and exactly if it is not getting cured in this particular days, they should go to see a doctor. It's the triggering point. So typically, what is the age, no matter what, the parent should not give cough syrup to the child? So do you think the diaper should not be used for the kids?
One example, when I was working in the regional hospital, we didn't have oxygen outlets in the wall where we can just push in the pipe and get oxygen straight away. We used to have long big cylinders with oxygen. What to do? We can't remove that. Patient also required oxygen. This child also requires oxygen. So what I did was,
in the Maldives, the local islands or in the isolated islands are healthier than the one in the urban places or in the city or the populated islands or say populated cities in the world. Is it true? Known that you have done a research in tropical infectious diseases, right? Is it safe for the child to put on the mosquito repellent or the patches or the cream that you just mentioned, or can it cause any skin diseases? So as a researcher, was there something that you were very confident about that you have to unlearn in the research, that okay, this does not work like this? One thing that you want to break the myth about, one thing the parents panic a lot, which they should not, and one thing which they're very careless about but they should panic about it, like overfeeding can cause problem, but of course feeding sugar is not that a big issue. But should mothers worry when their child is really underweight or not of a ideal weight because we were not given good nutrition when we were child, or something that has happened in the childhood wrong that is causing us this disease right now?
I haven't come across any research or anything about screen time causing autism. I don't know much on that as research, but I would say yes, when children are watching screen during meal times, during other times, and they are snacking, older children, let's say, and they're sitting not mobile, not getting any movement or exercise, and they keep eating and eating, yes, it is adding to their weight gain.
I want to ask that there are many parents which I have heard are very happy that, oh my god, my child is very active, my child is running every day, don't sit at all. So is it something that some parents don't know that their child is suffering from hyperactivity? So what is the first food you would like your child to taste? Boy, the child, you have removed the lump from his chest and you remember even 34 years later. Do you think Nipah virus also is a threat to children's right now? If you had the power to change the global health priority overnight. Every year, millions of children fall sick. It is not because we don't have the cure, but because either we have too much knowledge on the internet that we are confused with the cure, or we have lack of knowledge to reach to the cure. So the main question comes here is, are we really taking our child health seriously, or we are just waiting till it gets serious? Sometimes, somewhere between all these advices, your children continue to suffer very preventable diseases. So it is not about child health only. It is about systems, it is about success, it is about failures, it is about field research and a lot many things. So my guest for today is someone who is not going to talk for child health on the basis of theory alone. She has lived it, she has researched it, she has been on the field, and here she is sharing all the experience with you. She is a pediatrician specializing in pediatric infectious diseases and child nutrition with a PhD in tropical infectious disease and epidemiology. Her medical and academic training spans Pakistan, India, Australia, and the UK, and her professional work has taken her to Asia, Africa, and the US and Europe. Please join me in welcoming Dr. Rukhsana Ahmed. She has led complex field research studies as principal investigator at the Liverpool School of Tropical Medicine. She has been the founding member of Clinasia, a clinical research organization in Indonesia. So whether you're a parent, whether you're a researcher, a policymaker, or someone just normally want to understand about their child health, this one is for you. So heartful welcome, Ms. Rukhsana Ahmed. I'm really blessed to have you as my podcast guest, and especially in this holy month of Ramadan, so I'm really obliged to have you here. Before starting with this conversation, about medicine, about profession, and about the child nutrition, about the health and everything out there in the world, I want to know about the person behind the profession. So, what part of your identity you want to show to the world? Like, who are you?
Thank you, Shubhi, for having me. It's a pleasure to be on this podcast. And you have asked a very interesting question, which I have given oftentimes a lot of reflection. That does people know who I am, or in general, do people know a person besides their profession? So it's a good question. So when I like to see people to see me first and foremost as Rukhsana, not as the doctor, or these are titles that we gain much later. So my thought always on this is, a person is, when we are born, our parents give us a name, and that goes with us as our identity. So whatever profession, whatever path we may take, we remain that person. So I like to be Rukhsana. And the other way I like to lead myself is a person who has a love for sports, for smart eating, and also as a hobby I have writing. Sports, I feel, is something which gives us experience in team play, also in resilience, in determination and endurance. And smart eating, when I say, it's making those small choices which gives to us a longevity, health and well-being. And then writing as a hobby is what I like, is that, of course, I'm not an established or well-renowned writer, but it's something that personal experiences you can put onto words and keep it going. So that's what I really like. So for me, as you said, to know a person is not to be known only by the profession or the job the person does or the titles, but as a person. So that's what I like to say in this. So to know the person behind that profession or the job you do.
Oh, what a great start to this, I would say, because a doctor, I have never seen a doctor introducing themselves relating to sports or poetry or things like that, and talking about resilience, where you are actually getting your experiential learning into the academic learning and then shifting to the child health. That is amazing. So I want to ask you, like, was there a point in your time, everybody is into their present, with something happened in the past, I believe. So was there some movement where you thought that, okay, like, you have been through a great researcher, you have been a good academic person, you have tremendously doing great in the Maldives, I have heard, like, oh my god, lot of feedbacks for you. So was there a moment where you thought that, okay, keeping aside everything, child health is something I want to focus on?
Yeah, that's a very interesting question. When I was young in school and at a very early stage in my life, I got very curious to know about the inside, what's happening in our body. So that's actually what led me to study medicine. From an early age, I was interested. And also during my school days, we were doing an experiment, and that time we had these frogs dissected, and we were putting, of course, it's drugs now. We say how the heart pumps. So that made me very curious to see
Wow.
how the frog's heart is pumping, and then always thought, I want to know also what is happening inside us. So, of course, that led me to study medicine, and then, of course, when I was doing medicine and doing my housemanship, what is called then maybe equivalent to internship. I was doing my pediatric internship, and there when I saw these sick children, that's what led me. I thought, okay, this is something where I can, I got interested in, because you could see very sick children come in, we could treat them, and they get better and they leave the hospital quite well. Whereas when I was working in the adult side, I could see people were having a lot of chronic illnesses, which we keep repeatedly treating, but that doesn't seem to be reaching an end, or it's just controlling. So that's what made me go for pediatrics, and I thought this is where I can give more help to a larger community level.
Yeah.
So that's what I would say what made me interested in pediatrics.
Wow, like-
of course, with time things shift, but always loved pediatrics.
Like, it's
child
great to
health.
hear that like somebody is into this field because not they have to earn money or they just want to do a career or a degree in it, but they want to give to the society. And when I have heard of Miss Ruxana in the Maldives, I have always heard about giving service. So that's what I've always heard about you. So talking about the being in the child health and seeing in the chronic disease, are you talking about the time when you started your career 30 years back? During that time?
Yes, I'm talking starting back right from 30 years ago, when I was junior doctor, young doctor.
Wow.
And from that on, it's a long journey it has taken.
Yeah.
And thanks for what you're saying. I think, what I do, I'm sure a lot of others or most people will be doing is giving a service.
Yeah.
So partly it's our duty to give a service. And so I always try to do my best and within my capabilities to give what I can to the children, to the community, and also to resource limited settings. Yeah.
So, like being from the time you are saying you have seen a lot of sick children and people with chronic disease during that time, that is 30 years back, and especially being from a place that's an island place where there's very less resources, right? So, do you think the chronic diseases and the illness in the child is still the same? The percent is still same, or it is even increasing now with the lifestyle?
Yeah, very, very good question. Yeah, if we look at Maldives, I would say from way back to now, yes, we've had a rapid progress and development, and with that, of course, the illness, the diseases have shifted as well. So if we say in particular to children, yes, good thing is with vaccination, with better hygiene status, a lot of illnesses have been contained, or some of it has been also eliminated. But so there is a shift for us, and if we go to adults as well, we can see we have moved on from more infectious disease to more lifestyle diseases, or what is called non-communicable diseases. So of course we are seeing a lot of change now from when I was a junior doctor to what I'm seeing now. And in children too, we are seeing different illnesses from way back, say in the 80s or in 90s, what we saw and what we see now more commonly. Of course, some of the common illnesses, it goes everywhere, like children having fevers, coughs, so that remains.
That's the thing. My every sister-in-law I have, like I have almost 7 to 8 child in my home, and everyone is like they're having cough, they're having cold, they're having fever. So is it common? Do parents don't have to worry about that?
Well, a lot of sickness, illnesses start in children with either some stuffy nose, runny nose, and then going on for a fever and then cough. So as we call common cold, it is so common, it is called common cold. Being a parent, when a child is sick, even with a mild fever, as a parent, I think it is norm to get worried, to get
Okay.
concerned.
Yeah.
And of course, whenever a child is sick, parents will get concerned, and it's norm to get concerned. And if these things prolong, yes, they should seek medical help. So, yeah.
Because so many times, yeah, please continue.
I won't say they shouldn't be worried, but yeah, then we are here to help and to reassure and guide them what is a serious condition, what may lead to a serious condition, or what might be just
So if I
something
ask
common.
you
Yeah.
very precisely,
Yeah.
like how many days the child can be with the stuffy, runny nose or cold and cough, and exactly if it is not getting cured in this particular days, they should go to see a doctor. It's the triggering point.
Yeah. Well, if a child has a cough, usually we would say there are many things to look at, but if the cough persists for more than 2 weeks, 14 days, then they should seek medical help. Even before 2 weeks, if the cough is quite severe, the child is bringing up sputum, child's unable to sleep or breathing fast, then yes. So, but in a common cold or mild upper respiratory condition, about within 2 weeks, a cough should subside. So, if it prolongs beyond that, yes, definitely should seek help.
So the lot of, like, I've seen people giving cough syrups to their children in a very small age and giving not much medicines, but cough syrup is the rescue for the child who's just a newborn.
Yeah.
Or just like 6 months. And I've seen in many households they're like, okay, if he's having cough, let's give this. So is it okay, or is it really going to be serious in the coming years of his health?
Yes, in our part of the world, cough syrup is parents go for cough syrups very early, because for them, if a child is coughing, it is for a parent quite a
Yeah,
serious
yeah.
matter.
Yeah.
And but a lot of these cough syrups itself doesn't treat the cause. Some there are what is called there are medicines which is called for cough suppressants. But if
Okay.
you think of it, a cough, they're trying to bring out something. So something that the body don't want. So that's why you cough and sneeze.
Yeah.
When you breathe in, there are a lot of these germs, matter, that is microorganisms we cannot see, but the body doesn't want it, so they repel, and they want to get it out. So that's cough comes in some ways. Then, so a lot of the cough syrups are just as to suppress the cough, to ease the child, but it doesn't really cure the infection behind, if there is. And most often, 90% of time, these would be viral related conditions or infections, and it just takes its time. Yeah,
So typically, what is the age, no matter what, the parent should not give cough syrup to the child?
well, children below 6 months, I think they should seek medical help. There can be situations where doctors can prescribe under, yeah. And below 1 year also, cough medicines are not that useful.
I have seen a lot of people, not only in India, not only in the Maldives, but when I have experienced visiting to some other countries, or when we are traveling, we are seeing child are normally prone to wear diapers. Why I'm talking about this is many women's, curate this with the infectious diseases they have, or the rashes they have, or the skin problems they have. So do you think the diaper should not be used for the kids?
It's a very challenging question. We
Okay.
can think of diapers
Yeah.
in two ways, yeah.
Okay.
One is there's a lot of debate and talk about diapers, that it may not be very environment friendly. And today we want to have a environment friendly, earth friendly environment. So diapers create a lot of waste. It stays to degenerate, it takes time. So that is one way we have to look at a lot of these diapers. Secondly, I would say diapers itself wouldn't cause any infection. Yes, sometimes if parents take time, prolonged time to change diapers, and if a wet diaper stays in long, then the children may get what is called diaper rash or rash, and some infection from that. So ideally, if we use diapers, whether it's available diapers in the market or even cloth nappies, it's good to change frequently, not to keep the child with a wet nappy or a diaper for a longer period.
Okay, so
So
wearing
that
diaper
is
is not a problem, but changing it frequently should be the rescue.
the rescue, yeah.
So, talking about those times when you actually have worked, like, you almost have 30 years of experience. And living in the Maldives, even I have heard of many stories where the ambulance, the air ambulance or the medical help couldn't reach to the place, and we have to lost the
Yes.
treatment, or they couldn't do the treatment, or the patient has to basically go through something very bad. So how did you manage in the field where resources were limited? So maybe I believe that just the medical knowledge won't help there, right? You need to have some other fundamentals as well. So can you tell something that you have handled that time when it was not possible?
Yes, definitely. When we work in limited resource areas, it's we have to go beyond medical knowledge. Medical knowledge counts, no doubt, but we have to be adaptable. We have to be creative, and we have to stay calm, and we have to be reassurance, build a trust with the parents or with the community. So yeah, this takes back when I was a junior doctor. I did work in some of the regional hospitals. We had very limited resources then. We didn't even have x-rays. So a lot of our clinical knowledge comes in, use the stethoscope, listen, etc. So situations. So thinking of one example, when I was working in the regional hospital, we didn't have oxygen outlets in the wall where we can just push in the pipe and get oxygen straight away. We used to have long big cylinders with oxygen, and and there's limited number of cylinders. So once when I was working, I remember very clearly a child was brought who was in status asthma, mild breathing difficulty, and this child requires oxygen, and the cylinder we had was already being used for another patient, an adult patient. So what to do? We can't remove that patient, also required oxygen. This child also requires oxygen. So what I did was we took a IV drip tube and a needle, and to the pipe I put in the needle and connected to the child as well. So that's where adaptability comes. You have to be creative, and then I explained to the parents. We used it for both with one cylinder, double piping, and so we have to get a bit creative and innovative with ways to do. Another time I remember I attended, because I have a love for sports from always, so I also attended one of the sports events as doctor. We didn't have fancy equipment, etc. at the time, just basic first aid kit. And one of the players sprained the ankle. And at the time, we didn't have these ice cold packs, etc. So what I had to do was, there was a cooler box with drinks. And so from that, to take the ice, put in a towel, wrap it, and use it as the cold pack for the ankle sprain until help can come. So these are things, and you have to keep calm, develop the trust of the patient or the attendees. And so yes, there are many instances where when you look back, it takes, and as you mentioned, I would say that when we worked in the regional hospitals, there was time we didn't even have proper refrigerators. We had battery run refrigerators. We went to the islands to give vaccination with cooler box. Mobile teams went, but now things have changed. We have in every health center, every health facility, there are vaccine fridges where we can store vaccines, etc. So Yes, we get.
Wow, like
Yeah.
you being the scientist with the doctor and being the creative director and everything. It's amazing, to
Yeah.
hear these stories, because today, being the child of, being in today's generation, we have all the facilities, but actually handling the situation back then with these facilities is amazing, like what you have told.
Yeah.
So, many people say that the child in the rural areas or in the local villages, say in the Maldives, the local islands, or in the isolated islands, are healthier than the one in the urban places, or in the, like city, or the populated islands, or say populated cities in the world. Is it true?
Um, yes and no. In both ways, we can look at it. Yes,
Okay.
children in rural areas, yes, definitely gets less exposed to what we see in big cities, because there's a lot of pollution. There's a lot of air pollution, noise pollution, and also we have to think more in big cities in our part of the world too. A lot of these what we call junk food, processed foods, etc., have come in. So children get exposed to these things very early in big cities. So the environment, the food they eat, the water, the noise pollution, etc. So they affect their health. Whereas in rural areas, yes, still compared to urban cities, they're living with much less limited resources or limited environment. So the environment is much more cleaner, healthier. The air they get is better and more refreshing, so they have more space to run around and be children. If you take example of Maldives right now, if we take our cities, Malay area, most of the children are living inside apartments.
Yeah.
They have very less room to go out and play. Whereas if you go to the islands, children can wander around and it's still safe. And I mean, they're not have to worry that they might be hit by a vehicle, etc. They got space to play, to run around. They have, so we lack those garden spaces in our urban Malay area. So yes, in a way, within the environment, yes, children could be much healthier.
So talking about the child health particularly, like, every parent is aware of you can do this, you can do that, and they are very good with their own medicine and becomes the doctor. And I think it's all over the world. First I thought it's only in India, in my country, but I think it's all over the world. But I have known that you have done a research in tropical infectious diseases, right? So when we talk about this, and you have also done a PhD, you have not only studied that, but you have also researched and you have also implemented that. So what is something you want to tell the parents for the child not to do, so that they can't get infection? And before that, I want you to explain to the audience, who are not aware of this word tropical infectious research or disease, what exactly is this?
About tropical infectious disease, using the word tropics or tropical is, yes, a very interesting point you brought out. So tropical infectious diseases means more the diseases that are more common in the countries in the tropics, or in a way you can say the global south now, or below the equator. So it's diseases like mosquito-borne diseases, illnesses like malaria, dengue, to a less extent not so common now, but in pockets there's still filaria. Then there are other infectious diseases as well by insects, like we can say there is trachoma, sleeping sickness, a lot of these conditions where that's still seen in the countries within the tropics. So which is less common in the global north, or not seen in the global north. So that's how the term tropical infectious diseases
So basically
come.
you mean tropical means something that's coming more from the south.
Southern global south countries. And of course now more and more we use the word as global health, as rather than pointing as tropical. Yeah. So that's how it goes.
Okay,
Yeah,
so what,
yeah, so the infectious diseases, still we see a lot more infectious diseases in these countries. So we may still, with vaccination, etc., there are much less now. Like previously, we saw measles. Of course, now measles does occur. I can't say only in tropics. It is also common in global north as well. Not common, but it does occur in global north as well, and other conditions. A lot more infectious diseases related to insect-borne diseases, where because of temperature, humidity, these different types of insects thrive. So, and also helminths, worms, those type of illnesses, a lot occurs in these countries.
Yeah.
So that's where we say tropical infections.
Okay. So what would you suggest the parents to do so that their child don't get the infection? Like, through your research, is there something you concluded that, okay, this is something that is causing most of the infections in the children's?
Yeah. Well, I did most of my research on malaria, and malaria is, as most people will be aware, caused by the bite of the female Anopheles mosquito. And there are different types of these malaria infections and Anopheles, and it's caused by a parasite. So, of course, to protect from that, the main thing would be to protect from mosquitoes biting. So
Okay.
there are night biters. So if there are night biting mosquitoes and you're living in such an area, it's advisable to sleep under a bed net.
Okay.
And if there are day biters, then it's good to use protective creams or material in your body. If it's children, you can even, now we have patches, etc., that can be put on clothes when they go out. So basically, even dengue is a mosquito-borne condition. So to protect these insects biting children, that is the main thing. Then, of course, for other conditions, it's good nutrition, giving them balanced diet, keeping them, because that improves their immunity and it will protect them from illnesses. Then the other most important thing is, yes, parents should get children vaccinated, because a lot of the infectious diseases we now have vaccines, and indeed it has been going on for a long time now, for decades. So, and it's preventable. So we can say the world is almost eliminating polio through vaccination, diphtheria through vaccination, pertussis. So there is these vaccine preventable diseases. So parents should give attention and get their children vaccinated.
So is there any proper vaccination you would suggest that the child must have?
Well, there is the WHO recommended vaccine program, EPI, which is called Expanded Program of Immunization, which is running in almost all the countries. And so under that, all the common childhood infectious diseases are included. So all the vaccine preventable diseases come under that. And there are set timings for that. For example, in Maldives, we say at birth they will get a vaccine for called BCG to prevent from tuberculosis and hepatitis B, and then at 2 months another vaccine shots, then at 4 months, 6 months. So there's programs, and almost all countries have similar timing. Maybe some countries may have at 6 weeks and following on progresses like that. So yes, to follow the program, and most of the countries are doing very, very well with vaccination, and all children get vaccinated. In Maldives, there is a very high percentage of vaccination going on. So it's
even in the Maldives, the vaccination is free of cost.
Yes, it's a government program. So yes, all the common vaccine EPI included vaccines are under the government program.
Okay, so you mentioned about the vaccination, you mentioned about the child nutrition, you mentioned about malaria diagnostics. So there's a lot of things I want to ask to you. But before that, I want to ask one simple question. Is it safe for the child to put on the mosquito repellent or the patches or the cream that you just mentioned, or can it cause any skin diseases?
Most of those repellents are very safe. It's safe for the skin. So commonly no, but there could be occasional child who might be sensitive for
Okay.
just like any other drugs, etc. So in that sense, a child may get sensitivity to one of the skin repellents, but usually it is very safe. Yeah.
Okay. Okay.
So using a patch or a repellent is when you go outside is not so harmful.
Okay. So, yeah, like connecting that to the malaria research, what you have done. So, you have done the diagnostics research, right, in the malaria, and it's like for the world, and you are doing currently in the Indonesia, and you have been doing it for the world. So, how does it look on the ground? Because in malaria, people talk to about numbers, but we have often heard that the diseases that are talking numbers are actually the numbers are very alarming and it's not disclosed fully. So what does it look on the ground in the real life, researching about the malaria diagnostics? And also to the audiences, can you explain what exactly is diagnostics research in simple language?
Yeah. Yeah, diagnostics research is very simple. Diagnostic means something to test. So
Yeah.
when we talk of malaria, the diagnostic research means we do research in the community, the tests that are available. So when we talk of a test or a diagnostic tool, what we are looking for is something, for example, malaria is commonly a disease of the rural communities
Okay.
where there is again limited resources. And so we want to find a test, of course, it is vital that it should be accurate and validated. And but more than that, what the impact for the community would be something that is user friendly, which the rural communities can use, which is affordable, and it is quick and easy to use. So rather than there might be much more sophisticated tests in lab facilities, but in the rural communities, the people living in the rural communities may not get access to those lab facilities. So to get diagnosed, we need something simple, user-friendly, quick results, and affordable. And so when the term diagnostic research is, we just assess these diagnostic tools. There's a lot of diagnostic tools that have come out and that is coming out. So we assess it in the rural communities, how effective those tests are.
Yeah, interesting. Actually working on the field, I'm just imagining how it would be to actually, experience the learnings and samplings. So, as a researcher, was there something that you were very confident about that you have to unlearn in the research, that, okay, this does not work like this?
Yes, that's a very, very interesting question. Of course, definitely, I have had occasions to unlearn. Very early as a young researcher, I used to think data and methods was the most important thing and would be impactful. But along the line, I learned that to unlearn, what we need is more than taking knowledge as the hard truth, that you have to be flexible, you have to be open to questions. And so there are occasions where I learned that, yes, that is where I need to change the knowledge or what I think is the truth. I have to move from that and be more curious and to open out with questions. And that shifts to get more interconnections and also for people to accept what we provide.
Okay.
It
Nice.
becomes more
Yeah.
impactful.
Okay. So yeah, so you know you have been researching a lot about the child nutrition as well. So I want to ask one thing, what is one thing that you want to, break the myth about, one thing the parents panic a lot which they should not, and one thing which they're very careless about but they should panic about it.
Yeah, one thing about nutrition and when it comes to children, I would say it's best to shift from one rule to bringing in a balance diet. By this I mean a lot of children, parents I notice, are very afraid of fat
Okay.
to give to children. But fat is needed for children, for their brain development. For young
Okay.
children, we need to give healthy fats. But a lot of parents think maybe because they're older and their doctors might have told to reduce fat in their diet, so they may think, oh, fat is bad for children. But no,
Okay.
for growing children, we need to give fat.
Yeah.
And another myth is that sugar causes hyperactivity. Not hyperactivity is not directly related to sugars. Of course, if you overfeed a child with sugary stuff, it may show some changes. So we can move from that. So for a child's nutrition, the best is there should be balance. Like some things, organic food, we have to give our children organic food. But organic doesn't mean always it's nutritious. You have to create a balance. A balance, by balance I mean children should be given what we call the macronutrients, like carbohydrates, proteins, fats in their diet, and then the micronutrients, which is the minerals and the vitamins which come from vegetables and fruits. So there should be the balance in their plate. It's more than the quantity, the quality of, and you have to go over time. It's not one meal that would be
Enough.
nutritious or enough. Like, since I have a love for sports, I would say that just one exercise is not enough to build a person to be a good sports person or to win races or a game. We need to go consistency, we need to practice. So the same way for feeding children too, you have to give a balance and you have to give it over time.
Yeah, true. So, like you mentioned about sugar, like overfeeding can cause problem, but of course, feeding sugar is not that a big issue. But still, the confusion is going on. Like, there's been a long debate happening since all these years, and the new moms are struggling to convince their parents and grandparents that we should not give salt or sugar for 1 year to the child. What do you think about that?
Yes, until about 1 year, it's better not to give excess sugars and salts. So it's about, we say from about 6 months we start introducing solid food. So at the time, if we start introducing with sugary foods, that's the time children develop tastes.
Okay.
And so what would happen is they would, because sugar is sweet food, we all, as even adults, we love for sugar
course,
food.
yeah.
And the moment we say something sweet, even before going for a dinner, we think, what is there for dessert? That is
true.
more.
Yeah.
So, of course, when we start feeding children around 6 months, if we start off with a lot of sweet foods, then their palate will get used to this sweet taste. And so then they wouldn't want to eat other food. So that will start rejecting, because who would want to eat when you have a nice sweety taste, food that may taste a bit bitter or sour, that's not as nice as a sweet taste. So yes, feeding too much sugar and high salt is not good for children below 1 year.
Okay, so like after 1 year, and it is not because of any health concern, because that's the myth I want to break of so many parents around there worrying about it, but it should be because they should not develop the taste for too much of salty
more for the
or
taste.
sugary
And of
foods.
course, feeding too much sugars means, of course, it can also affect the child to become more, even small children, we have to look at, there is a certain weight they have to follow. Even if their young, even a 6 month, 7 month, or an 8 month, if they're going above the curve, the parents have to get concerned because most parents or even family, friends, everyone will think the child is chubby, that's very cute, but we have to take, even for those young children, there is a certain weight they have to be kept at.
Basically, for a newborn, what is the best weight you would say is a healthy child weight?
It's hard to say the best weight. It's a whole range. So
Okay.
what we usually say is if a child is below 2.5 kilos, it's a low weight, low birth weight. And something above between 2.5 to 3 would be the average weight for 3 kilos is the average weight in our populations.
Okay.
So, and if some child goes beyond 3.5, then it's again a baby is born that we will say is overweight or more weight. So a range is always there. Weight is dynamic, and so there is always a range. We can't fix on a certain fixed number, but a range.
But should mothers worry when their child is really underweight or not of a ideal weight?
Yes, definitely. If the child is underweight or falling off the tracks, we have where they what we call the growth monitoring. So monthly, we advise the children to be brought to take their weights and to monitor it. And each child will form their track. There is certain percentile lines that are on the growth chart. And if a child is cutting downwards, it is concerned, same way as I said, if the child's weight is shifting above and if they start going beyond 90th centile, that is also concerned. So it's not only, most of the time parents tend to worry in our society, what I've experienced is parents tend to worry when the child is a bit underweight or falling down. Very few parents worry when the child's weight is going up, but that is of equal concern.
Oh, so that is also alarming when the child weight is going up.
And in today's world, childhood obesity is becoming a huge problem. And that is related to the unhealthy food, the so-called junk foods the children like to eat, or they are being given a lot of packaged foods. And so childhood obesity is... Parents may not realize, and a lot of people don't realize, but when children, as a child, you're obese, it's hard to think ahead, 20 years ahead, but it's research that is showing, and it's well known now, that childhood obesity leads to adulthood chronic diseases like diabetes, hypertension, hypercholesterolemia, even joint pains, a lot of the illnesses of adults. And when children or childhood obesity, these chronic or non-communicable diseases, as they now call NCDs, they start much early.
So it's like a very interesting thing you told, the diseases which we suffer now in the adulthood or maybe in the older age because we were not given good nutrition when we were child, or something that has happened in the childhood wrong that is causing us this disease right now. So
not totally. I would say there is also genetics and environment factors as well, but a lot of time, yes, childhood nutrition is very, very important because it is what is giving the child the growth, their brain development, their bone development. So nutrition is the foundation for the child, for their adulthood life. So yes, giving a good, balanced, nutritious diet in childhood is very important. But of course, there is things that we cannot change, genetic factors, environment factors, hereditary factors that can also play a role.
Yeah, it's interesting to know. And also, like you talked about nutrition, you talked about child eating the junk food. Likewise, I remembered about screen time, relating to the junk food, that many, even sometimes we have the habit of watching television and we can't take our eyes off when we are eating, so it's not a mindful eating basically. And I have also heard somewhere in the research, if I'm not wrong, that the screen time is making children fat or also causing autism in the children. Is it true?
I haven't come across any research or anything about screen time causing autism. I don't know much on that as research, but I would say yes, when children are watching screen, during meal times, during other times, and they are snacking, older children, let's say, and they're sitting not mobile, not getting any movement or exercise, and they keep eating and eating. Yes, it is adding to their weight gain. So screen time is causing a lot of issues, not only gaining weight. We haven't done a study, but I see an observational method that a lot of children's speech is getting affected. When young children are being shown excessive screen, they start mimicking the cartoons they see, and their speech, when they start talking, they are making sounds or trying to talk like these cartoons, or that is what they hear quite constantly. So that's what is causing. So yes, screen overuse of screen is affecting health, affecting the child's growth in different ways. So it is not that, and it also creates anxiety depending on what they watch. So it affects their sleep and disrupts sleep as well. So some children wake up with nightmares, etc. So yes, screen overuse of screen is also not a healthy thing and not a very good thing to go. So a lot of parents, and some of the time notice young parents, maybe both parents are working, so they leave the child with grandparents or with a nanny. In Maldivian society, at least, this is happening. And children active, as I said, they're living inside a small apartment, not much space to go out and play. So the iPad or the phone or the TV screen becomes a different nanny. To keep the children quiet, a program is put on and you keep the screen in front. The child is sitting quietly, so it helps the grandparents or it helps the nanny. They can focus on other things. Otherwise, they have to run around after the child. So this is affecting the children's way of life.
Yeah, true. Because I just remembered a story. I have one of my friends, she is a braille expert. So she teaches special childs with blindness. So she told me a story that she was pregnant, and when she was pregnant, she used to go to take these classes. And one of the child who was, was special child with blindness, used to do some actions. And when her child was born, the child used to do same actions. So, like you talked about the nightmare thing, actually this happens, right? That she told that even during pregnancy, where the child cannot see but still can feel and sense things. So even I was shocked, does it happen like even the mothers during pregnancy has to be very cautious of what they're seeing, what they're eating. What they're eating is okay, like acceptable, but what they're seeing or what environment they are in.
Yeah, this is very, very interesting. I haven't heard of it before. Yeah, you have to look into that more. Yeah, definitely, yes. What parents eat during pregnancy is very, very important, because what they eat, there is research saying that leads to the children's taste as well. So yes, what parents eat during pregnancy is important for the child's not only growth but development of taste. And then is what they hear or listen, I don't know to say whether there is any scientific evidence yet. As far as I know, I don't know of that, but it's very interesting, something to look into. Yes,
she is from the Maldives itself.
Right. So something.
Yeah, we hear such stories, and then we learn from life. And as we talk about special ability, so is it like from the time when you were handling things 30 years back, there were less cases of special abilities in children with Alzheimer's, or is it at the current stage where they are rising or alarming?
Yeah, You mean children with autism?
Yeah,
Yes,
autisms
yes,
and
yes. Yes, very, very important question. Yes, I worked in Maldives as a junior doctor in the early 90s, and I would say I saw very less of cases of autism or ADHD.
okay.
Then I have come back almost after 30 years, and I see alarmingly large number of cases of autism and ADHD. So there is a shift, but I think there is also a global shift, and it can be many things. Maybe we got better diagnosis now. People are more aware. They bring children to the health facilities, to the medical profession much earlier. So we are picking these cases much early. So that might be, but yes, there is a shift we see, and of course population has grown as well, so there is a bigger number of larger number of cases that we see of these different childhood conditions like autism, ADHD, etc.
So, like we were talking about autism, I want to ask that there are many parents which I have heard are very happy that, oh my god, my child is very active, my child is, running every day, don't sit at all. So, is it something that some parents don't know that their child is suffering from hyperactivity?
Yeah. We can take it both ways. Yeah. Children are active. And children would run and play. So, to label children, we have to be cautious. Definitely, we have to draw the line between in whether this is a condition as what we call hyperactivity, or is it the normal behavior of children. So, because all children will have a lot of energy, they want to extend it out, so they will run around and play and move around, and of course if they're confined to small apartment spaces, the parents or the grandparents would see them much frequently running around, because while, let's say, parents are watching TV, the children are jumping around, and so they are hyperactive. Whereas in the good old days in Maldives, when we had big gardens, children are out playing in the garden, while parents might be doing something in the kitchen. So they may not see the children running around, jumping around. So there is definitely a line to be drawn, and we have to be cautious of because every child that runs around or jumps around may not be a child with a hyperactive attention deficit condition. But of course, there are certain clues and parents can pick up, and if they're concerned, they have to bring to the doctors or to seek medical help to assess. So that is. So I don't know to say that when children are jumping and running, whether we should be proud about it, because yes, all children, of course, if a child is not showing normal activity, then it should be also a concern. Yeah.
Okay. So, what are the clues one parent should look to find that, okay, their children is not active but hyperactive?
Yeah.
And
Difficult in these days to say, because there is also over-diagnosing of this hyperactivity. So more we have to look at are children able to focus, concentrate for periods of time, or they cannot concentrate, they sit still, they just jump from one thing to another without paying attention. So these are certain things to think of as clues. And I think a lot of teachers also will be able to pick this up.
Okay, so I think we have talked a lot about child nutrition and health, and you have given some really insightful thoughts on it, because we already have enough knowledge, but the thoughts that you have given, I think, can definitely alarm the parents out there. And the last thing I want to ask is related to a newborn or related to the child, who's within 1 year, that what is the best time the parent should start the toothpaste for the child?
Okay.
Yeah.
Toothpaste for child is when the child's tooth comes, tooth erupts. That is the timing for it. And say once 2 or 3 tooth erupts, just not when the first tooth maybe. So that would be the time they should, because using toothpaste, using brushing is also something for habit forming. So the
Okay.
earlier they start, the better. The child will
Okay.
get used to it. The child will
Okay.
get into the habit
Okay.
of brushing the teeth and cleaning the teeth,
Okay.
and especially at night before going to bed. So as soon as teeth starts erupting, and once the children have 2 or 3 teeth, then that's about the time they should start
Okay.
brushing.
So, like, if I ask you, what would be the first food you would feed to your child after stopping milk? Like, usually you say that 6 months, after 6 months, you should start feeding your child. So, what is the first food you would like your child to taste at
Yes,
first place?
very, very good question. Yeah, 6 months is about the time we say complementary feeding should be started. And around that time, what should be given is something that is easily digestible, that should be soft on the palate and also in the intestine, and for the child to swallow. And it is, when we say start solid, introduces solid at 6 months, a lot of time what parents forget is that it's a transition, because the child has been taking milk, which is purely a liquid food,
Yeah.
and this is the transition to start swallowing, to use bit more solid. So start developing tastes as well, and texture. So the first foods should be something smooth, as I said, easily palatable. And to answer your question, if I have child, then what would be the first food that I would give? It would be something like rice porridge
Okay.
that would be made into a paste,
Yeah.
and to start with, and to give a lot of the first time parents especially, they're very enthusiastic to start feeding the child.
Yeah.
And they make a whole bowl of food, and they want the first day the child is 6 months to
Yeah.
feed and finish. But what parents should understand is that first day the child is still just learning. It's a transition. So it's just to give 1 spoonful or
Okay.
2, and the child may
Yeah.
blow it out as well. That
Yeah.
doesn't mean the child didn't like the food. Maybe the child is not ready or
I
didn't
think
know to swallow.
that much we give in we call it Annaprasana ceremony, where is the first time the kid is having the food,
Yeah.
and we have like all the family members present there, and
see.
it's like 20 or 25 of them, and everyone is feeding
The
something. Yeah.
Right.
And it is believed that first time we have to feed something sweet, and from there the history starts. So, yeah. This is
Yeah.
there. So yes, we have.
Yeah.
It's interesting to know your choices. So
I would
now,
say on that topic, yes, culture, tradition is a good thing. We
Yeah.
have to respect it. We have to go with it. But I think, at the first day, a child won't be able to take more than 1 or 2 spoons. So
Yeah.
not good to give more.
True. And also, let's talk about you, Miss Ruxana. I want to know that you speak fluently 4 languages, that is Hindi, English, Urdu, and Divehi, the local language of Maldives. So, and you're very good at it. You have interest in sports. You are good in like poetry, and you have a lot of research-based knowledge, and working not only scientifically but also keeping the human inside you around, and humanity around you alive. So I want to ask, does knowing different languages make it easy to connect with patients and communities?
Yes, definitely, because if we speak the language of the community, of the person you're dealing with, it connects much, much better. So, of course, the languages you have mentioned, it comes by kind of default, I can say, because I did my basic MBBS studies in Pakistan. So that gave me a grounding in Urdu, and at the time in the hospital, to be able to speak to the patients, to the people in their language, it made a huge difference. And then much later with my research project, etc., I did work in India,
Yeah.
in Madhya Pradesh,
Yeah.
where there is Hindi by itself, pure Hindi, and I worked with rural community. So,
Okay.
of course, being able to speak, and as you know, Urdu and Hindi are quite
Very
related,
similar,
very
yeah.
similar. So, it was very easy for me to switch from Urdu to Hindi
Mm-hmm.
as well, and it gave people more trust in me. They opened up much easier when you speak to them in their language. So yes, it definitely helps to be able to talk in the person's language and to the level of their understanding.
But it's a big art, let me tell you, because I have been globally around where with people, but it's very difficult for me to, even in Divehi, I only know 2-3 words, because even Divehi is very similar to Hindi somewhere. So I only know few words. So to learn different languages and connect with communities, I think you have to be more of a good listener than a speaker. Do you agree?
Yes, yes, I definitely agree. You learn by listening, and
Yeah.
that is very much true.
What does home mean to you now? Like after leaving and working across many countries, doing research, you have been into the UK, US, Pakistan, you have been to Indonesia. So what do you think about, what is your definition of your home?
Well, you have to go with the old adage. Home is where
Yeah.
your heart is.
Yeah,
Yeah.
yeah.
So,
So-
yes, I have had. I've been fortunate with work, with studies, and of course my interest in travel. I have seen a lot of the world, traveled to many places, and also lived in many places for long periods. So the question, where is home? That's something I also ask. And since I write poetry, but unfortunately I didn't bring today, I have a little poem written about
Oh.
where is home. So
Oh.
maybe I can share with you later.
Definitely.
So home is, just where you feel most comfortable. But wherever I am, I try to be, make myself as comfortable and be with the people. So that makes it a difference. So to say where is home, it's a hard question to answer because also Maldives now is not the Maldives I saw as a teenager. So when I came back here after many, many years of living abroad, I had to adjust here as like into a foreign country.
Oh.
Although I have my family, of course, I know the
Yeah.
language and it's where
True.
my roots are. So
Yeah.
it's not that hard, but it's a huge change. So
Okay.
yes, home is, I would say, where your heart is.
Yeah, it totally tells that you're more, human than scientific. And I want to read one of the feedback that I have come across, which you, for a boy, the child, you have removed the lump from his chest, and you remember even 34 years later. So there's a feedback. My sister visited pediatrician Dr. Ruxana at Treetop for my niece appointment. During their conversation, my sister mentioned her native island and our father. To our amazement, Dr. Ruxana immediately remembered my father, his island, and his frequent visit to her home many years ago. She also clearly recalled performing surgery on his 2-year-old son, removing a lump from his chest 34 years ago. And when she had just completed her MBBS and was serving at a government hospital, she then asked my sister if that child was her brother and where is he now. When my sister told her that I'm married and living in Malé, the doctor kindly requested to see me at the next appointment. And a month later, I had the blessing of meeting Dr. Ruxana, the doctor who saved me as a child at a time when medical facilities were far more limited. She was incredibly warm and welcoming, and it felt like I had known her for a long time. I thank Dr. Ruxana from the bottom of my heart for remembering me and my surgery after 34 long years. Words are not enough to express gratitude for such kindness and generous heart. So reading this, I can see you're getting little emotional. So definitely, even when I read this, I was like, wow, are there people still who will remember me when they treated me when I was like 1 year old or something? So what's the story
It is,
behind
yeah.
this? Yeah.
Yes, it is quite touching, and yes,
Yeah.
I'm sure there is many. That's the time, as I said before, that we worked with very limited resources. And as a junior doctor, as a medical officer, we didn't have many specialists at the time in Maldives. So we did a lot of things. For the family, of course, him being around 2 years probably didn't remember, but for the family, it might have been a big thing. For us, or for me as a doctor, I probably was just performing what I knew and what I needed to do at the moment, and did my job in a way, of course. And so, but seeing this after so many years and realizing that there are families who remember these small deeds. For us, it's a small deed. So for so many years, and indeed, perhaps that which was a lump, which I would have done a simple procedure, if it was left untreated, might have developed into sepsis, septicemia, infection. We don't know what it could have led to. And so, yes, hearing that really touched me, because what we do without realizing, but has a big impact on the family and on people. So that is, part of the work I do. I feel that, if we could make one small change in one person's life, it fills me with quite
definitely
happiness.
I would say an emotional ending. Even I am feeling emotional right now, because it is having a goosebumps, and it is quite a long feedback. But I wanted to know, tell my audience that yes, humanity exists. It's not still gone, because everybody is talking about these viruses and everything. Do you think Nipah virus also is a threat to children's right now?
Nipah virus is quite a cause. When it affects, it causes a nasty infection. I think recently there was some cases in India, especially. So it hasn't gone out of control. It's already controlled. So whether it's for children or for adults, if it occurs, it can be quite a debilitating condition.
Okay. Okay, so Miss Ruxana, it was like a pleasure talking to you. So one last thing that I want to ask you is, if there is any person who's looking at this podcast or listening to this podcast right now, what advice you would give them to be in your position where you are today, to pursue and not to be afraid to be in that step?
It's a hard question you have given me. Yeah, it depends on the person. But, my take-home message would be, whether as being a doctor, don't treat patients as cases, treat them as human beings, treat them as the condition you see, but also you remember they are human beings, not just the lab numbers, test numbers that you see. So always remember that we are dealing with humans, and the human, don't move away from the human perspective. So be empathetic, be calm, gain your trust from the patient, and always remember that the human touch is the most important service we can give.
Yeah, true. So I promise this is my last question right now. So if you had the power to change the global health priority overnight, what would it be?
Let me think, reflect. Yes, global health. I would say the most important perspective would be to focus on prevention. We tend to wait late until the disease occurs and then come to get the service or the treatment or care from medical professions. So the most important thing is take preventive measures. It's always, as again an old adage we would all know, prevention is better than cure. So before it happens, take the steps and try to prevent a disease occurring, because if you come once it has happened, oftentimes it might be too late. And that's where oftentimes with the best of medicine, the world has developed scientifically, digitally, etc., but still there's limitations for treating different conditions, medical conditions. So it's always better to take the preventive measures. So my take on this would be, I'm not saying we shouldn't develop curative services, but preventive measures should be emphasized and make the communities aware of what could be done to prevent conditions occurring in them.
Yeah, truly thoughtful. Like, we should not be confused with lot of knowledge available, and definitely go to an expert to ask about it.
Yeah.
So thank you so much, Miss Ruxana. You have given us such insightful and thoughtful, perspectives on the child health, malaria research, and we'll definitely meet in the future because there's a lot to talk with you. And let me tell you, you're not a doctor, you're a healer, definitely.
Thank you. Thank you, Shubhi. It's been my pleasure to be on this.
Yeah.
Thank you very much.